Hey everybody, it's Chris. Got another new interview for you today with Dr. Kelly Blodgett. He is a holistic dentist, and I'm excited to interview him because I have never interviewed a holistic dentist, and I get questions about holistic dentistry all the time. And these questions are usually about mercury fillings and root canals and the best procedures and best alternatives for this kind of stuff. And so, I'm just really looking forward to digging in. So, Dr. Kelly Blodgett, thanks for taking the time.
Thanks, Chris. I'm excited to be on with you. I think we're probably going to get into some good stuff today, and hopefully, those who listen are able to take this with them and make some awesome, optimal choices for their health.
I hope so. That's the goal. So let's start with your background, how you got into holistic dentistry and your, training and credentials, that kind of stuff.
Sure. So, part of my story is that I started out as thinking I wanted to be a psychologist, so I went to college, got a degree in psychology. And part of my journey is that, I came to the Lord my senior year of college and suddenly found myself being led in a very different direction. And I felt called to become a dentist, and specifically to change the negative stereotype of dentistry. So for the past almost 30 years now, I've gone through dental school and residency and started a business and been led along this path of developing technologies and such, or integrating technologies, I should say, in the practice. But it wasn't until maybe 5, 6, maybe 7 years ago that I really started to appreciate how, and this makes some sense, I suppose, when you've observed care for 15 years, you start to see these patterns of what works and what doesn't work. And I really started to appreciate the extent to which we weren't respecting biology. And as you mentioned, things like putting mercury in a place where you breathe and swallow, that's crazy making. Yet the powers that be would tell us it's totally safe, even though, there are warning labels on the box when you buy it. You have to have a mercury separation system when you drill it out of teeth on the back end of the suction system. But somehow it's miraculously safe in your mouth, things like that. That's just crazy.
Well, talk about, since you mentioned it, let's dig into mercury just a little bit. When was mercury first introduced into dentistry?
Almost 200 years ago.
Yeah. And that's all you need to know, folks. That's it. Right. They used to give mercury as medicine to people, right? They gave mercury to Shakespeare, excuse me, Shakespeare, to Shakespeare for syphilis. Okay. Yeah. Okay. So they started putting it in people's mouths 200 years ago.
Yeah.
At what point did we learn that it was the most toxic, non-radioactive metal on Earth?
Right. Well, and it's such an interesting story because at that time when mercury came into dentistry, there was already an organization of dentists, the American College of Dental Surgeons. And they said, hey, now, that's clearly toxic to people's health. We're not going to buy into that. And as a matter of fact, they said, if you want to continue to be a member of our organization, you won't use it in people's mouths. And those dentists that said, hey, we're going to use it anyways, we're going to start our own organization that is pro mercury filling, amongst other things. And that's what turned into what is now the American Dental Association.
Wow. So that's what caused the formation of the ADA was really over mercury?
That's part of my understanding of that. Yes. So the American College of Dental Surgeons ended up folding, because there just were, I get it. At that time, what else were you going to put into people's mouths? They didn't have composite bonding and things that we have today. So I can appreciate they were kind of in a bind, but if something's toxic, at the very least, inform the recipient, And instead, of course, the marketing around that for the past 150, 200 years has been, oh, it's totally safe. Somehow the copper and silver and tin that's in the filling somehow binds it, which is absolutely false. There's so much science that has proven it is constantly releasing mercury vapor. Even the American Dental Association 2 years ago released a press release saying, okay, we do admit it is off-gassing at all times. However, we still would say it's safe enough for most adults and blah, blah, blah. It's crazy.
That is crazy. And let me mention,
yeah.
So if I talk about this in my book, for those of you who've read it, and in my course, but if you haven't Googled this video called "Smoking Teeth Equals Poison Gas,"
yeah.
If you Google this video, it was produced by IAOMT, Hal Huggins, or I don't know.
Yeah. Yep.
And those folks, and they just show you the mercury vapor that is coming off of mercury fillings after they've been pulled out of people's mouths with just very gentle agitation. You can see it under it's special lighting. It's like a black light or whatever, right?
Yeah. Right.
But watch that video. It's just a few minutes long. And I remember the first time I saw it, I had read that mercury was, I knew mercury was toxic. Well, you learned that in grade school. And I had read when I got cancer, obviously when you're learning about what causes cancer, and mercury was certainly on that list. And at some point during my cancer journey, I read that silver fillings were 50% mercury. And I was like, oh, wow, I didn't realize that. And then I saw that video a few years later, and it was like, oh man, that tells a very different story than this is, the quote unquote, this is safe and not a problem.
Yeah. Yeah. It's unbelievable. The amount, when I think about the amount that I have taken out of people's mouths over the past 25 years, it's a little scary. It wasn't until 3 or 4 years ago that we started exercising the SMART protocol that the IAOMT put together. Prior to that, we would isolate with rubber dams, but the vapor is going everywhere. So thankfully, we now practice smarter, but I think, gosh, that is a lot of mercury that my team and I had been exposed to, because we're sitting over the patient huffing that in all the time.
Yeah. And so what is the latest mercury removal protocol look like?
Yeah. Yeah. So it's extensive. And I'm not a huge follower of any dogma, to be honest. In our practice, we have a laminated sheet for patients who are having mercury removed. And we say, like, here are all the things that we're going to do. And here are a few extras if you want to put them on, like, donning a full body suit, protective suit. We have those available to people. Some people don't feel comfortable, like they're claustrophobic in all of that garb. So, it's open to them. But point being is, people have the option to completely cover themselves, and we're going to isolate the tooth with a non-latex rubber dam. And then we have special suction units, both suction that sits in the dam itself, as well as the suction unit that sits right next to their head. Because the idea is, as you're creating an aerosol, if you can have that aerosol going into a vacuum system, which then filters that air, like, that makes perfect sense. And of course, it's kind of coincidental, but when COVID hit, we're like, well, we're not concerned about aerosols. We've been using these suction units for years now. So it's in a dental setting, any dentist who's already set up to do these SMART protocols, boy, the level of health advantage that patients have in those practices is remarkable.
That's great. And it makes a lot of sense. My wife had mercury fillings, and a couple that she had taken out years ago. It was kind of right after I learned all this stuff. So she might have had hers out in 2005, back then. But yeah, there were no protocols.
Yeah.
It was a regular dentist who took them out, and we didn't know any better, right? So mercury is a very toxic substance. When you take it out of somebody's mouth, you have to follow very specific disposal requirements, correct? You can't just throw it in the trash, right?
No, it all goes into a very, I mean, like I mentioned, we have in our efflux line, the suction lines, there is what's called a mercury separator. And we have to have that serviced. If special equipment, people come in and service that, take it away, and, they dispose of it however they dispose of it. But all of those mercury fillings and dust and all that, it is treated as a hazardous waste because it is. So yeah, isn't that, I mean, it's just crazy. It's so toxic that you have to have a special team come in and take it away, but don't worry about it when it's in your mouth, I mean,
Right. It's in your mouth, it's safe. Out of your mouth, hazardous waste.
yeah,
Yeah,
completely crazy.
I think that pretty much is all you need to communicate to someone
Yeah.
for them to be like, what? Wait a second. Are you serious? So, okay. What do you use instead of mercury?
Yeah, good question. So our first step with people, honestly, like let's say they're at a place where they're at risk for decay and we're noticing the starts of breakdown. The first thing we want to do is figure out why. Is it possible for you to remineralize your own teeth? Because it is possible. Your saliva is built to remineralize your own teeth. So if we can help people on the front end to that extent, that's the best by far, right? No dentistry is absolutely the best dentistry. But let's say you're removing old fillings. It's either going to be, in my practice, one of two things. Sometimes we use dental composite materials. It's tooth colored, which is made of glass particles in a resin matrix. And we're able to put that directly into the tooth and light cure it into position. And you can actually physically glue it to the tooth. When a restoration is relatively small, that's typically the direction that I go. If it is larger, then what I'm going to use would be a ceramic restoration. And in my practice, we mill those out of a block in the same visit so people don't have to wear temporaries. Because, if we're thinking about the term that you used at the start, holistic, which means to think about the entire health of the whole person, the last thing I want to do is put some temporary in a tooth where bacteria can enter the tooth for 3 weeks before I glue it, which leads to sensitivity and all these sorts of problems, right? So anyway, it's a single visit where we can make the ceramic restoration and then glue it into the tooth. And whether it's an inlay, an onlay, a crown, a veneer, whatever it is, a porcelain tooth part, I kind of call it like a puzzle piece, right? And then we just glue it in there and away we go.
Do you also use ozone for sterilization?
Yeah. So every tooth that we bond, anything we bond, we use ozone before we would bond to that tooth. The most teeth that we're restoring have been exposed to the second layer of the tooth, which is full of micropores. And of course, usually there's microbes in there. So for years before I had ozone around, we used to use a product that was like it's called Gluma. It was a glutaraldehyde based, substance. And it was very effective in terms of killing bugs. But, you get this stuff into the gums and the mucosa, and it's toxic to the tissue. So thankfully, 5 years ago, when we got into ozone, we got rid of that. And now we use ozone gas to, put into people's dentin or basically you're exposing the dentin to the gas, and it desensitizes the tooth and sterilizes it. That way you're able to seal it over and avoid things like post-treatment sensitivity, which is a huge issue for a lot of dentists.
Yeah, absolutely. I certainly know people that have, had dental work and then their tooth hurts for a while and they have to go back because something's off or whatever. And I get it. Like sometimes that happens and it just has to be addressed. But so you mentioned remineralization.
Yeah.
And in cavities. So there's two different things here, right? Obviously, right now we're talking about somebody that's already got fillings, they got mercury, they're taking them out. You want to replace it with something that's safe, non-toxic. But for someone who comes in and they've got a cavity, a small cavity or whatever, you're not one to rush to do a filling there, right? How do you approach that?
Correct. Well, and I think that something that's important to consider anytime I see somebody who's new to the practice, and let's say it's somebody that's 35 years old, they've got some areas in the teeth that look suspicious. Maybe they've lost some mineral. When this is the first time I've met them, what I don't know is, did they lose that mineral over the past 6 months or over the past 30 years? I don't know. I don't have the advantage of looking at, well, where was it 10 years ago, 20 years ago? So depending on their overall health and lifestyle choices and general risk for oral diseases such as decay, we might choose to treat that area with some ozone, which again would help to decrease any potential microbiological activity, and observe it for some time. If it's not a frank cavity, like an actual hole in the tooth, I'm okay with being patient and observing it. If we find over 2 years' time it hasn't progressed at all, it's still a sound surface of the tooth, like why would we drill into that? But when I think about when I had to take my board exams, we were looking for those almost next to nothing things in teeth to drill, because the risk of drilling into a nerve at that point was so low, especially as a newbie dentist. It's just funny how the perspectives have changed to where we want to honor and respect the natural physiological structures of people's bodies and teeth, which, of course would include teeth. But that's, in dental school, we're taught like drill it and fill it. It's kind of the model of care.
What are some of the things that you find that are really destroying people's teeth, aside from meth?
Yeah, golly, I was thinking about this recently. I mean, when you look at, for a lot of children, the nature of the crappy nutrition that they've been exposed to in their first 10 to 12 years of life frequently will lead to, like, a lot of kids, by the time they get their second molars, they've already had a number of fillings. Some kids, even before they start getting their permanent teeth at like age 5 or 6, they've already been under sedation. The quality of nutrition is significantly lacking. There are so many factors we could consider that lead to, whether it be a heightened state of sympathetic overdrive, even for children, constantly on screen time, and then not having, not having fresh air, not having sunlight, not having optimal nutrition. It's like all these things lead into disease expression, and the mouth is one of the first places we start seeing that expression. And just, if we think about overall toxic risk or oxidative stress risk, if kids are getting fillings and or maybe even, God forbid, root canals in their teen years, by the time they're 40, they've had sometimes 30 years of exposure to the microbial garbage that's getting into their jawbones. It's just such a picture of risk, yet we still, to this day, most dentists are trained, heck, we're all trained to think as though the teeth don't connect to the body in any significant way. When we see obvious areas of pathology, whether it be like an abscess or something around the tip of a root, like, yeah, we just think it's something localized to that tooth, you'll be fine. Yet it's circulating throughout the whole body. We understand that, it's this weird disconnect. And unfortunately, dentistry is kind of the outlier in healthcare that isn't considered when people are dealing with cancer, thyroid dysfunction, diabetes, heart disease, all these significant health issues, yet rarely are the dentists ever being called to weigh in on how's the health of the mouth. It's just not even part of the picture.
Yeah, that makes a lot of sense, especially this approach that is a holistic approach, looking at the whole body and realizing that, look, your body, every part of your body is connected to the other parts, right? You have all these
Yeah.
interconnected systems that work together. And if one system is not functioning optimally, if one system is disabled or distressed, diseased,
Yeah.
yeah, it's not in a vacuum. right? It's going to affect the other systems in some way. And so I know there's been, hypothesis about, dental health and gum disease and whatever, mouth problems, we'll just call it that,
Yep.
and cancers and specific types of cancer and things like that. And I know there's a lot more research to be done there. And at this point, I think a lot of it is just hypothetical, but I don't think it should be ignored.
Oh, for sure. Yeah, and that's the problem, is that it's just not a part of the picture. So it's thankfully through what I've been sharing, on social media and such. I mean, we have had acupuncturists, we've had chiropractors, people of different health specialties who have come to our practice to observe how do we connect with our patients and talk about health as a whole, and how our area of specialty is connected with everything else. And of course, we're not here to be nutritional specialists or chiropractors or anything like that. Like, we make good referrals. But it's so nice to look through that lens, because people then start to actually get healthy. And the mouth is often at the root cause of so many people's health struggles. It's kind of funny, you think about the American Heart Association has a protocol. When a person has a synthetic heart valve or an artificial heart valve, they must take antibiotics 1 hour prior to their dental procedure, particularly even cleanings. To get your teeth cleaned, you've got to take antibiotics because of the heart risk. But somebody who has an abscessed tooth, we just go, you're fine, or a cavitation lesion in your jaw, let's say, because we don't have enough science, we're not going to use common sense, apparently. And, and people suffer. So it keeps us all too busy, unfortunately, Chris.
Let's talk about fluoride.
Sure.
What's your opinion there?
Well, my observation, I have a few opinions, but my observation has been, regardless of the amount of fluoride that people have ingested and applied, it hasn't significantly impacted the expression of disease, for one. The side effects, shall we say, of applying fluoride to teeth, like we focus completely on what we're doing to the tooth. Yet it's impossible to apply fluoride to the teeth and not have the mucosa, your cheeks, your underside of your tongue, also, get exposed to it, which is some of the most absorptive tissue in our bodies. And the science is very clear that when you're absorbing fluoride, you will have negative neurological consequences. So again, it's just like the Mercury issue. Like, we just ignore using common sense, that if we know scientifically it's going to cause neurological damage, well, if we just focus on the tooth part and ignore, don't tell people about the rest, we can keep using it. And it makes no sense. And also, like, for how many millennia was fluoride not an addition to people's water supplies intentionally? And many centuries went by where people overall weren't expressing dental disease, right? And because they're eating a healthy native diet, foods weren't processed for the longest time, and they did fine. And a lot of it gets back to nutrition and gastrointestinal health. Are we able to absorb quality nutrients if we're getting them at all? And how does that help our mouth stay healthy, just as it would the rest of the body? So we have to look at things in its wholeness to really help people, which is, heck, the person that we refer to more than anybody else in our practice is a functional nutritionist. People who come in, they're like, oh yeah, I've got these gut issues. We got to straighten that issue up, right? It's a critical part of being connected to your oral health. So, but yeah, personally, I don't use fluoride. Nobody in my family does. Your saliva is designed to remineralize your teeth very effectively. But in order to have healthy saliva, you have to have healthy blood, which means you have to absorb your nutrients.
Right. The nutrients that strengthen your teeth, your bones, your muscles, all of your cells come from food. They got to go in your mouth, through your digestive system, into your bloodstream, and then circulate around and come back into the roots of your teeth, right? And obviously your saliva is helping too from the outside, but
for sure.
But even those nutrients are coming through to your salivary glands, right? And coming through that way as well. And so it all just makes too much sense, obviously. And I haven't used fluoridated toothpaste in, I don't know, probably 18 years.
Yeah.
Haven't had a cavity. We remove fluoride from our drinking water with a fluoride filter. I don't know. I just don't have any use for it. There's a few documentaries. The Fluoride Deception is a pretty good book about this. Christopher Bryson, I think, wrote that. And then my favorite documentary, favorite documentary title is called An Inconvenient Tooth.
Oh yeah.
You remember that one?
Yes, that's awesome.
Yeah. And they if anybody wants to really go down the rabbit hole and understand fluoride, how fluoride ended up being used in toothpaste and added to our water supply, it was just sort of a way for the aluminum industry to get rid of some toxic waste that they didn't know what to do with. Again, more toxic waste. They can't dump it in rivers and streams, but they can put it in your water supply and claim that it's going to make your teeth healthier. So anyway, well, that's good to know. I'm glad we're on the same page on the fluoride thing. Not that I'm surprised that that we would be. What else is different? I want to talk about root canals, but before we get into root canals, what else is different about your approach, about holistic dentistry that we haven't covered yet?
Yeah. And this is something that is completely unique as far as I know, with my practice in particular, is the way in which we welcome people into our practice. Typically on most weeks, we reserve Monday for our new patient experiences. And meaning that is all that we do. Every Monday, we will see 14 to 15 new patients from usually across the country. And each person gets approximately a 2-hour block of time reserved just for them. Those experiences are designed to be more about understanding them as a human being, understanding what their experience in dentistry has been like, to understand the nature of the health challenges that they have faced, and how they suspect or feel or believe that those oral health issues are affecting their health. Because by the time they find us, usually they have been told by many people in their health journey that, well, that's not possible, So we've come to appreciate that by really connecting soul to soul with other human beings. We're able to get to the bottom of what it is they're hoping to accomplish. And then we go about seeing how can we help from an oral health perspective, and who else might we need to involve in this journey? Might it be an osteopathic physician? Might it be a nutritional therapist? Things like that. So every time I talk to other dental practices and I explain to them that of the 4 clinical days that we are in the office every week, we spend one entire day only talking with people. That's all we do, and they're like, what? You giving up one whole clinical day? And it's like, yeah, and we've never provided better care in our lives. I mean, so that is something that, and I am out there, to some extent, talking to dentists across the country, sharing this, because I think that in order to really help people recognize and honor what they're feeling and make some intentional choices around how to improve their oral health, we have to slow down and really acknowledge some of the pain and fear and challenge that many people have faced when they're talking with a lot of dental teams, right? So I think that's something that's pretty special about how we function. And it came it was the result of 20 years of trying to connect with new patients while we were doing a bunch of other stuff. And it's like, it just doesn't work. We have to slow down. So that's been a real blessing.
I love that. That is
Thank you.
amazing. And you're the first dentist I've ever talked to that has that particular type of practice. Are there others that have followed that model, or is that something that's pretty unique to you?
So far, it is unique to my practice as far as I know it. As I've gone through my journey, I keep meeting new dentists that are open to these ideas. Like I'm talking to one fellow who's in Iowa, heck of a neat guy. And he and I had a long conversation, maybe a month and a half ago, because he explained to his wife what we're doing. And of course, she, not a dentist, she's like, well, that makes perfect sense. When do we start? And so they're looking to start practicing that. And my goal is to mentor him and offer whatever, I can share. I mean, we learn every day, of course. So I hope to impact at least a handful of practices in my journey, because I think that there are a lot of wonderful human beings out there in the dental profession who want to do right by their patients, but because they're in this mindset of, I've got to be on an insurance program, I have to drill teeth every day or I'm not going to make a living. It's like, we have to free ourselves from those constraints to really be able to help people in a meaningful way. So it's taken a little bit of bravery and all that, but it's working really well. And the patients, the fact that they're coming from around the country every week is probably quite telling.
Yeah, I can imagine so. I think people like it. I like it a lot. I think it's wonderful that you're also thinking about and trying to connect them with other practitioners, because you're seeing, a person is coming in, right? And you're seeing, in some cases or many cases, a person who maybe has some health problems that are larger than just their mouth, right? And knowing that, like, you can fix their teeth, but it's not going to really fix their overall health,
Yeah.
right? And they may need some more guidance and counseling and other professionals, health and medical professionals in their life to help them improve their diet, start exercising, break their bad habits, stop smoking, stop drinking, get away from junk food, processed food, and fast food, all this kind of stuff. And it's hard to cover all that in one dental appointment.
Right. Yeah.
Yeah. So I love it. I appreciate that so much.
Thank you.
Do you have a different strategy or practice with x-rays than a typical dentist?
Well, yeah, I mean, because of the nature of where we're working, right? Inside the head, and of course, the nature of so much of what has been done to people, particularly areas where teeth have been extracted and areas where people have had root canals, there's a lot you cannot see with two-dimensional radiography. So our standard of care here in a new patient experience is we're going to get a full series of two-dimensional x-rays as well as three-dimensional cone beam CT scans. We don't often have to take those like annually, but we have to have a good baseline. We also do a very specific series of photographs, because another part of how I like to connect with people is for them to see exactly what we see. So we'll do a series of an actual picture of their face, the human being, and then kind of move inward as we go. And it's so cool when they see three-dimensional imagery of their head, their skull, and photographs, they connect the dots and see okay, I see how that's all connected now. And they can make choices for themselves. I mean, one of the phrases I do not use is need. I never tell somebody, well, you need a filling, you need a crown, you need a root canal. I don't say that word. So we just explain, here's what we see. Here's how we understand that impacts your health. And then they go, all right, well, good. How do we fix it? So we go, great. Well, here would be your options. So it makes that interaction very, we start to see at the same level, which is pretty cool.
I appreciate how conscientious you are about the language that you use with
Thank
patients
you.
because as a former cancer patient, as a patient advocate, um, obviously not a dental patient advocate, but a cancer patient advocate and health and wellness advocate, like the
Yeah.
language is really important. And
Oh,
a lot of doctors, maybe intentionally in some cases and unintentionally in others, they use language that's uh, intimidating,
mhm.
that makes patients feel stupid. Um, that is, and in worst cases, it's just downright condescending and bullying,
Yeah.
right?
No, I agree.
And just that word you need, right? All of a sudden, you're sort of putting them in this like, oh, you're like kind of bossing them around. You need this.
Well, I mean, the idea, I wrote a post a couple of years ago that said, you don't need, or nobody needs a root canal. And it got so much engagement. Of course, I tend to be good at inflaming dental students and endodontists, right?
Yeah,
Because
for
they're like,
sure.
what do you mean?
Antagonizing.
Right. And I'm like, well, think about it. I mean, people, we have patients, some, not many, but some who have literally no teeth in their mouth. And they're the nicest human beings. They eat on a daily basis. They're not missing meals. So it's like, you don't need teeth. It's a weird concept as a dentist to say out loud, but you really don't need teeth. They are awesome to have. It's kind of like saying you don't have to have a leg, but I'm glad I have both. I want to work hard to keep them. So similarly, it would be a choice, and it would be a choice if you chose a root canal or you chose mercury filling because of whatever reason. I believe you are entitled to that autonomy. The unfortunate problem is no people aren't given it. They aren't offered autonomy. They're, as you said, I like that they're almost intimidated. Ultimately, that's the feeling aspect of what happens in most practices, which is that is not relationship building, you know?
Yeah, I understand that. And I think the stakes are so much higher in the cancer world,
Sure.
right? When you need chemo,
Right.
you know
Oh,
what I
yeah.
mean? I mean, the stakes are so much higher with that kind of a conversation than, you need a filling or you need a root canal. But still, I really appreciate the fact that you're so, I said it already, I'll say it again, conscientious about the way you present options to your patients. That really, really says a lot about you as a person to me. So that's really cool.
Thank
Okay, so
you.
perfect transition is root canals.
Yeah.
So, what, uh, I guess my questions are, do you do them? What are the alternatives to root canals? Are there problems with root canals?
Yeah. Yeah. Well, I would say, I was certainly trained to do root canals as a dental student, as a general practice resident at the Veterans Hospital here in Portland. I mean, I did tons of root canals. Um, and for probably the first 15 years of my practice career, I was doing root canals and trying to do everything the best way that I could, integrating, lasers and ozone. But at the end of the day, I started recognizing, one, they fail. I mean, go figure, you leave a dead organ inside of living bone, and at some point, the body's going to say enough, and
What does
it'll
that
act.
mean? What does failure mean for a root canal? I've never had
Yes,
one, so I don't know.
sure, sure. Well, I mean, arguably, it's a funny idea. It's a funny phrase, actually, because there's inaccuracy in saying failure of a root canal. Like a root canal can't fail, only the tooth can fail. And it's more a biological consideration of how long will the body tolerate a dead and energetically inappropriate organ sitting in live bone. So
So a
arguably,
root canal, and just for anybody, because I think there's people that don't really know what root canals
oh,
are,
sure, sure, yeah,
and as I understand it, and correct me if I'm wrong,
sure,
it's the way to preserve a tooth. The tooth is basically dead, but you're preserving it in the mouth, so there isn't a hole there,
right,
right?
right.
And what is the process in a root canal?
Yeah, so it's helpful to understand, when we talk and smile and all this and everything we see in our smiles, we're looking at enamel, which is it's a minuscule amount of the tooth. The majority of your tooth is actually dentin, which is still hard, but mostly collagen. And then inside every tooth, you actually have living tissue, like blood supply, little veins, little nerves, and that's like when people have feeling, oh, that's sensitive, right? I mean, you have soft tissue living inside of your tooth. Now, a lot of times, whether it's due to trauma, decay, dental work that you just had, which is unfortunately all too common, the nerve can get inflamed. And it's an interesting proposition when you consider if inflammation starts in an area where it cannot expand. Like you smack your thumb with a hammer, it's going to swell, right? You bite your lip, it's going to swell. If you irritate a nerve and it tries to swell, but physiologically it can't because it's bound by hard walls, it will self-constrict and die. At that point, dentists are saying, well, you need a root canal, in quotes. And of course, people don't know any better. So they go in, they drill into the tooth, they remove whatever's there, whether it's infected or pus or whatever. And the idea is we're going to fill that canal space with material that's filled with metal oxides and all sorts of stuff. And, cross our fingers that things go well. Now, to your point, Chris, absolutely. The benefit of a root canal is you keep the tooth, which has aesthetic benefits, and you can keep chewing on it. Absolutely, those are benefits. The downsides are within 30 days, that tooth will become teeming with microbes, which slowly, leaks its way into the jawbone. Your immune system then has to clear it away constantly. So you now have the oxidative stress or toxic stress, if you want to consider it that way, of that burden, along with it loses its energy flow. So teeth exist along energetic meridians, just as every other part of your body. So that then goes dormant. It's like putting a resistor into an electrical circuit. So pros and cons. Some people, like I think of my mother, for instance, who's a crazy vitally woman. I mean, she has so much vitality, a lot of energy. She had some root canals done like 50 years ago. And now in her late 70s, we're just starting to see her body saying, no, thank you. It's like and it looks like bone starts to melt away and an abscess forms. And the body's like, what do I do with this stuff, right? It can be painful. It can put you at an increased risk for heart attacks and other health issues. So whether it's a 2-year window that you get to keep the teeth, 20 years, I don't know. It can vary. But what I believe is important is to offer that kind of information, pros, cons, risks, benefits, and then help people look at the other side. Well, what if I take it out? And then what are my options? Do I have to replace it? To which the answer is no, you don't have to replace it. You could actually leave the space open. There will be consequences to it, but there'll also be benefits. You don't have to go through surgery again. You could do a bridge. You could do an implant. You could literally, and I've done this hundreds of times. Let's say it's a front tooth. You could take the tooth out. Sometimes you could even cut off the root of the tooth, fill it in with some composite and polish it and bond the top part into the adjacent teeth. It looks just like them. Looks awesome. Yet they don't have that infected root sitting in their jawbone anymore. So there's a lot to consider. Unfortunately, so many of the people who come to see us, they're at the last leg of this health journey because they've been suffering so long. They know they've done everything else. They've done the detoxes. Still, they're struggling. And oftentimes it boils down to root canal treated teeth. And not for everybody, but for a lot of people that we help, by the day that we take those teeth out, they start noticing health shifts immediately. And it is fascinating stuff to watch. And at the very least, I would love for people to understand they have that option. They could remove dead teeth instead of having the root canal done.
And pun intended, root canals can be the root cause of chronic health problems.
Absolutely.
So for those of you watching, I wouldn't rule it out. I wouldn't assume if you have chronic fatigue, if you have inflammation, if you have autoimmune, if you have cancer, if you have any health problems at all, a chronic, like you said, it's almost like a festering infection in a root canal. It becomes a breeding ground for pathogenic microbes that leave your mouth, right? And they circulate into other parts of your body. That could be causing you health problems.
Yep.
I know some practitioners, holistic cancer practitioners, that insist that every cancer patient they work with gets their root canals taken out. That's
Yeah.
how convinced they are that they're problematic. And I know there's, I was researching this when I was writing my first book, and it was actually hard to find. And I ended up taking this section out of my book because I couldn't find a lot of verifiable data and studies and evidence. It was all anecdotal, which I believe when doctors and professionals share their anecdotes and their experience. I don't dismiss that, right?
Yeah. Right.
I take it into consideration. I'm open to it. But anyway, the whole point I'm getting at is I couldn't find like any really good studies on root canals and the connection to cancer, although it is talked about a lot in the holistic cancer world, alternative cancer world, about this connection between root canals and cancer and them increasing your risk of cancer, for example. But anyway, I couldn't find anything like that. But even though the studies haven't been done, I still wouldn't rule it out.
Oh, for sure. Well, and of course, like if it's not on anybody's radar, like who's going to pay to do the research? I mean, there has to be money behind a group taking on, or it's just going to be, funded privately. Like for me, over the last 5 years, I've probably spent personally over $250,000 on testing root canal teeth that I had extracted, sending in just the root, right? So from the bone level inward, sending in only the roots to a lab in Denver and having them analyze the roots to see, are there microbes in these roots? They're supposed to be sterile, or at least that's the claim by endodontists, right? Like, oh, we've cleaned it out, it's great. Out of over 500 roots that we sent in, not a single one came back sterile. So that was kind of telling, and I got to the point where I'm like, all right, that's enough scientific evidence for me. I don't need to send them in anymore unless somebody wants to know. Absolutely, we always offer it. But I'm convinced that it's not to say that, the root canal will cause your cancer, let's say. Like it's possible, of course, but will it increase the stress load or the burden that your body is dealing with on a day-to-day basis to make it harder to deal with all these other health issues? Absolutely. And again, I think if people had that information, they would be better equipped to make a decision which is consistent with their own values, which is what we take away from them when we say a term like, you need X.
I love the way you put that. And something I also repeat all the time is the goal is to reduce your toxic load, right? That's the goal. That's what we're trying to help people do. And that's a stepwise process of systematically changing their diet, their daily routine, what they're putting on their skin, and what's in your mouth, mercury fillings, fluoride, toothpaste, and root canals can all be contributing to your overall toxic load. And when your body's overloaded with toxic stuff, right, that's just coming in every single day, then that creates problems. I mean, it's more work for your immune system. It's more work for your liver, detoxification systems. They're promoting inflammation. So your body's combating inflammatory issues. And so there's this cascade, right? Of is it bacterial? Is it viral? Is it fungal? Is it inflammatory? Is it just, a toxic metal? You just think about this synergistic toxicity of all of these elements.
Right.
And, again, is it one thing causing your cancer? And in a lot of cases, my answer is no, right? Unless you live next to a plutonium factory, right?
Yeah.
If that's the case, yeah, it's probably the plutonium. But generally, yeah, it's just the toxic soup that we're exposed to over time, over years of our lives, not just in a weekend.
For sure.
Okay, I want to be respectful of your time. Let me think. Is there anything else that we've covered? Oh, there's one other thing that I thought about. I wanted to ask you earlier, and that is, you mentioned cultures for thousands of years, right? There's lots of cultures, and healthy cultures have been studied. Weston Price is a famous dentist that went around
Yeah.
and studied healthy cultures and observed them having very healthy teeth and eating very simple rudimentary diets, that they were growing locally in their villages and parts of Africa and Asia and all over the world. It makes me wonder, and I'd love your opinion on this. Do you think that the overconsumption of food, in other words, just eating too often, may be also contributing to poor dental health, even if it's, healthy stuff, because
Yeah.
our ancestors didn't consume as much food as we do.
Yeah, absolutely. Well, and it's funny because I can recall, so I was in college in the late 80s and early 90s, and I remember the food thinking or the nutrition thinking of the day was so crazy.
The pyramid.
Well, and also Chris, don't eat fat, right? God forbid, don't eat fat. But make sure that you snack all the time. And it's like, to your point, this doesn't follow anything that historically we've done as a culture, but we can, right? Because we can walk into 7-Eleven, get a big gulp that's in an insulated mug, sip on the Coca-Cola and snack out of my bag, the bag of chips all day long. Or the healthy, quote unquote, healthy equivalent of that is, and I've seen this, people who come in and I'm like, okay, by what you're telling me you're eating and what you're choosing to eat, I would think low risk, but you're breaking down. What's going on? And we have to start talking about things like frequency. And it turns out, oh, I am sipping on kombucha in my car for 6 to 8 hours a day while I'm driving around and running my kids to and fro and snacking on, granola. And it's just kind of eat as you go. And it's like any of us can tolerate that for a short window of time, but it's when it becomes the day to day to day to day, and then month after month, and then year after year, things will break down. I've seen lately, this is probably within the last two years, so many people that are doing the lemon juice and apple cider vinegar deal. And they're literally sipping on acid all day long because they're led to believe somehow, or maybe they've chosen to believe it's going to help me digest because I'm struggling with my gastrointestinal issues. And it's like, oh boy. I mean, I've had patients where you're like, for 5 years, you had a totally healthy mouth and now everything's melting. What happened? And, it's like, when you change that, it's going to have consequences. It'd be helpful to consider that ahead of time. But yeah, absolutely. That's such a major factor, like the frequency of eating. Oh man, huge.
This is really cool. I'm excited because, so lemon juice and apple cider vinegar, folks, are awesome, but don't sip on it. Just get it down quickly. Okay.
Yeah.
Let me put that one out there. But in case anyone misunderstands you, okay. So here's my hypothesis. Please correct me if I'm off base here. In my understanding, when we eat food, our saliva produces very specific enzymes that are breaking down food, right? This is the first part of digestion. It's not just the chomping and the chewing and the crushing, right? It's also the enzymes in our saliva that aren't there when we're not eating, right? So as soon as you start to eat, these enzymes are released. And these enzymes also can eat at your tooth enamel, right? They're the same kind of breakdown enzymes that could affect the health of your teeth. And so if you're snacking and eating constantly all day, right, these enzymes are in high circulation, high concentration in your mouth all day. And that would be, in a sense, or probably, again, I'm hypothesizing, but, contributing to premature tooth decay.
Yeah.
Does that sound off base, or does that sound
it's
reasonable?
I think that's I mean, again, it's a whole thing. So, and that's part of it. The analogy that I use with patients is, imagine your teeth. Every time you put something in your mouth, your teeth are taking a dive into the acid pool. Now they're going to hop right back out, and it takes about 30 minutes for them to dry off. Unfortunately, most people are every 5 minutes, throwing something in their mouth, or even every 30 minutes. God forbid, you're sitting at your cubicle desk, snacking on, your dried fruit and nut mix, and you're sipping it down with some tea that has honey and lemon. Again, it's all delicious stuff. Why not, right? But when you expose your mouth to acids, which part of the journey there is that you've got frank acids, the ones we put in our mouth, which will melt teeth, along with salivary enzymes, breaking down food particles, some of which will create acids and then, continue that process of breakdown. And it can take years, but it can also be quite irreversible if not caught early. So yeah, I mean, the saliva when we're not eating is designed to be protective, even through when we're sleeping at night. And now here's something else for people to consider is like almost every single drug out on the market, not all of them, but the vast majority will cause xerostomia. They will lead to a decrease in salivary flow rate. So if we want to mess with our digestion, which is arguably one of the core aspects of healthfulness, start taking prescription medications and you will have an impact. I'm not here to tell people do or don't take your doctor prescribed drugs, but understand there will be oral health consequences along with other, health consequences across the body. So,
and you're talking about dry mouth, right?
Absolutely.
Essentially.
Yep.
So less saliva, and that is problematic for digestion.
Right. 100%.
Yeah. Hey, another, it's pharmaceuticals are just the gift that keeps on giving. just side effects on top of side effects in every way you never thought possible. Okay. So this is really revelatory. And our ancestors would go through periods of food scarcity, right? They weren't eating 3 times a day in many cases. They weren't snacking all day, and they were going through periods of food scarcity where they might go a day without eating, or they might go several days without eating, right? These are this sort of involuntary fast, right? And we know how wonderful fasting is for our overall health, but the connection with fasting and dental health is something I think is not talked about much at all, but based on what we've been talking about now, it makes a lot of sense. Like you're breaking that constant acidic assault on your teeth and giving your body and your saliva the opportunity to strengthen and remineralize your teeth when you go through periods of not eating.
Right. Absolutely. We are big fans in my practice of approaching people's care in a very bio-individualized way. So, we kind of connect with them about, because some people, and how it's like the intermittent fasting thing, it has become marketed, as of late, and figuring out like what helps you feel your best, and connecting with people on that so that it becomes something they own and is about them, not about dogma, I have found is so helpful in an approach to care, because then it becomes meaningful and relevant to them personally.
Yeah, and I think it's really great advice too to say, why don't you try this and see how you feel?
Sure. Yeah.
Right.
Absolutely.
See how you feel. Now you may feel not feel great the first few days of intermittent fasting, or the first few days of eating a plant-based diet, right? Or trying not to drink coffee all day. Like when you're trying to break unhealthy lifestyle habits, the first few days you won't feel better. So you got to get over that hump, folks. But okay, this is my last question, and along the lines of what we're talking about is my particular opinion, my personal hypothesis is that gum chewing is not good for you. I don't chew gum. I've never liked it. Even as a kid, I felt like every time I chewed gum, it was like either it was like in my hair or on my clothes, or I stepped in it or something. So like for some reason, like early on, I just never liked gum. But I feel like this is right along the lines of what we're talking about. When you're chewing gum constantly, you're tricking your body into thinking you're eating constantly. Your saliva is producing these, break down food enzymes. What's your thoughts?
Yeah, I'm completely in agreement with that. long before I was a dentist, and much like you, I mean, as a kid, I was kind of like, it was the cool thing to do to grab a big league chew before a baseball game or something. And it was always seemed gross to me. And then maybe in college, I just got to thinking, why would I want to tell my stomach to prepare for digestion, but I'm not eating anything? And then add on top of that, what in the hell's in the gum? Especially the sugar-free gum. Is that something you want to be putting in your body? Like, what's the point? I'm personally not a fan, no judgment about anybody that wants to choose it. But I think that trying to turn the on switch of digestion when you're not actually eating doesn't make a lot of physiological sense to me.
Yeah, we're in agreement. Totally. I'm glad to hear you say that. And I think, I mean, I don't know that it's even really been studied. I think people just assume, even scientists, like, oh, it's just gum chewing, it's benign, right? But you're sending signals to your body that you're eating all day long. You're secreting the saliva that's trying to digest the gum, and it's impossible. Even if the gum was pure gum, from a gum tree, right? With no additives, no preservatives, even if it was the cleanest, purest thing possible, you're still going through that act of chewing. So anyway, that's really interesting. And there may be some light bulbs going off for folks too, because I think if you're eating a super healthy diet and everything, but you're also a gum chewer, right? And you're chewing gum all day, every day, and you're getting some cavities. Well, hey, I wouldn't rule it out. The gum could be contributing to this problem.
Yep.
Cool. All right. Well, anything we haven't covered? Again, I thank you for being so generous with your time. And what else do people need to know? And beyond that, how can people find you and connect with you?
Sure.
Please share.
No, I appreciate that. So most people find me through Instagram. My name on there is at Blodgett Dental Care. The website is blodgettdentalcare.com. For people who are interested in experiencing the dental tourism options that we have created, which includes discounts at hotels in Portland, and my team helps you walk through the whole process of getting here. What would be most helpful in the means of helping humanity would be if people would share with every human being that they know my Instagram page, because my intention throughout my life, well, at least since God called me to become a dentist and do this, is I want to help change people's experiences in the dental sphere, because most people do have fear and anxiety around it, at least a majority in my experience. So if we can help change that, I think that would be massively helpful for people's health overall, because if you're scared of it, yet it's a contributing part of why you're sick, we've got a real problem, right? So anyway, that's my intention, is to be out there in the world and sharing this with dentists, sharing it with lay people, just creating awareness that the mouth is in fact critically connected to the rest of the body. And the longer we ignore it, the longer people will suffer. So I hope
that's
people
fantastic.
will share that. Yeah.
Great. You're welcome. And I'm going to put links below the video, everybody, in the description and the show notes, so they can connect with you, Dr. Kelly Blodgett, and your Instagram page, your website, all that kind of stuff. And for folks that aren't able to travel, I get this question a lot, and I'm embarrassed to say I don't know the best answer, but people ask me, how do I find a holistic dentist in my area? And I usually say, well, Google holistic dentist and your name of your city, right? But is there a database? Are there associations that people can, a website people can go to and put their city in, and some dentists will pop up that way? I know IAOMT is kind of my default, but is there another resource like that online?
Yeah. One of the things that, and this is probably more broadly helpful, because I get that question, as you can imagine, there isn't a day that goes by I don't get that question. Like, who do you know in Tallahassee? And then what I ask, because I really do think it's important. I mean, currently, either I'm answering people or one of my team members are. And I asked, like, are you looking for a quote unquote holistic dentist, meaning somebody who has slapped that word on their banner? Do you want somebody who identifies as a holistic dentist, or do you want somebody who thinks and behaves the way that I do? Because you're asking me. So therefore, I suspect that what I write and how I connect with human beings is resonating with you. Because there are a multitude of great dentists out there who don't consider themselves holistic, biological, what have you, and they could help you so well. And unfortunately, there's no easy button. There's no website to go to. Certainly the IAOMT, the IABDM, the International Academy of Biological Dentistry and Medicine, also the Holistic Dental Association. I would say arguably you have more outside of the box thinkers. The American Academy of Oral Systemic Health also, again, dentists who tend to be thinking more outside the box and more along the lines of connections of oral health and the rest of the body. But the important thing to appreciate there is that may, and I have seen this more times than I care to share, that may just be the new dogma of that practice. And now everybody needs their root canals out. Everybody needs their mercury out. And that's just not how we approach things. Again, I want to make this about human connection and autonomy, and about decision-making that the person can own and make based on their own values, not about some new dogma. And in order for a person to find somebody in Tallahassee or, Sheboygan or wherever, you're going to have to do work. You're going to have to do work. It's kind of like finding a spouse. Most people that I know didn't just marry the first person they met. It's like you have to find somebody with whom you're connected and you share interests and values and energy. And once it clicks, then you're like, awesome. That's the person for me.
Mine was mail order.
Yeah. I'm sure your wife loves that.
Yeah. So that's great. I will definitely link to those other resources. Thank you for sharing that. And you're right. You got to beat the bushes, right? You got to ask around. You obviously got to Google it. Are there the main search terms going to be holistic dentistry, biological dentist? Is there any other, terminology that folks like yourself use, or are those the two main ones?
Yeah, over my 20 some years of doing this, I've seen an evolution of the terms du jour, right? So it's like today, holistic, biological, functional, whatever that means. Again, I don't know. Somebody calls up and says, I called because I want a holistic dentist. I don't make any assumptions that I know what holistic means to that person.
Sure.
So, but those are the terms that dentists are starting to use. To be clear, there are no specialties in dentistry, like accredited specialties that are holistic, biological, or functional. They're just terms that dentists use to describe the methodology for most. Some of the messages I get more than anything, Chris, are people who say, so I went to the biological dentist here in town and they told me I need a root canal. And I'm like, okay, so it's just a term.
Yeah. So what you're saying is there isn't really a certification and standards and practices that people say, I am, a certified biological dentist. And with that statement, right, I'm ensuring you that this is the type of practice I do. It can be just used as sort of a marketing hook.
Well, and that's true. I will say there is the American Naturopathic Medical Association, through whom I hold 2 board certifications in naturopathic dentistry and integrative biological dental medicine. So that was like a 1.5, 2-year-long program that I went through to, earn that. But that you don't find a lot of dentists who take the time and money, frankly, to invest in that kind of learning, because it's a lot. I will say, if you find somebody who's gone through that sort of training, that certification, they probably know their stuff, and they probably are going to think more along the lines of what I'm sharing here. Not all, but probably most do. I mean, that's when people ask me, do you know somebody in Kansas? I'll say, well, actually, I do know a guy. Not every state, right? In Texas, I know a couple people there. But
You know, what would be helpful is maybe having your own directory on your website for the folks that you
we're getting
definitely
there.
know and can vouch for. That, even though it's not going to be in every city or every state, maybe, but
Yeah.
yeah.
That's the next iteration of my career, I think, is honestly offering to dentists that want to learn how to do this, learn how they can make a good living, but also learn how they can help people in real meaningful ways and empowering them. Like, that's a magic mix, and it's so special. So that's what I hope to do over the next 20, 30 years, is offer that to teams that want to learn it, so that we will have a bigger pool from which people can choose across the country and maybe outside.
I think it's a noble pursuit to
Thank you,
transform
sir.
dentistry for the better. That's awesome.
Thank
Well,
you.
Dr. Kelly Blodgett, you're an amazing human. Thank you for taking the time to talk and share what you've learned with my audience. And I know you're going to get a flood of followers and fans and messages and things like that. So I'm excited for you there.
Thank you.
And okay, folks, thanks for watching. And please share this with everybody you know. This is chock full of good information, really valuable stuff. If you made it this far in the interview, you know. So help us reach more people, like it, share it, subscribe, and I'll see you on the next one.